Hello, I'm David Mason. I'm the Director of Public Health for the town of Sandwich, and we're doing another public service announcement, number 4, regarding coronavirus. And again, we had talked in the past about different topics we'd be bringing forward, and we're going to do that today. We're going to talk about wellness in the elderly population, and today we will have Susan Morancic, who's the Senior and Community Service Director for the Council on Aging, and then Jackie Lane, who is the Executive Director of NAMI, which is the National Alliance on Mental Illness. But we have today Chief Burke with us too, and he's going to give us an update where we're at today relative to the coronavirus.
Thank you, Dave. As of today, there are 16 positive cases in the town of Sandwich. The age range is 23 to 85. Out of those 16 patients, 3 are hospitalized and 13 are at home isolation with mild symptoms. Just a reminder for folks, if you call us and call 911, it's important that you explain all of your symptoms ahead of time so our personnel can be dressed appropriately. So even if you have an incident where you fall and it's not respiratory or fever related, if you've had a cough or you're feeling weak, we need that information relayed to the dispatch so we can bring that to our personnel.
Thanks, JJ. And then Susan, can you give us an introduction to your position and what you're doing for seniors during these times?
Good morning. We run really 2 businesses at the Council on Aging. One is operating the Senior Center, which most of you already know we have canceled all programs, events, activities. All of our volunteers are sheltering in place at home, but we are staffed. That is very important to know. So the business of the Council on Aging continues. I am in the office by myself. I'm not sure if that was by vote, but I am in the office. But all of the staff that you know and love are working at home, fully connected with computers and cell phones. You can call the office. Either I will answer and relay messages. You can also leave a voicemail message there. So we are very reachable. Should you happen to get a busy signal, try again in a little while and you will be able to get through. I do want to summarize for you the services that we have ongoing. First of all, transportation continues on a very limited basis. We are taking people out for medical appointments. That is only for critical or essential appointments. And we're working with everybody to make sure they're in touch with their doctors to be sure that those appointments are actually still happening. We are also doing shopping trips on a very limited basis. 2 people at a time. We are only using our vehicles, our drivers. The vehicles are being disinfected before and after the trips. We are only going to the grocery store and the pharmacies in town, both the CVS and the Stop and Shop pharmacies. So please call us and we'll work with you to get you out to get what you need. So just remember, if you do have other resources to help get supplies to you, it helps us if you can work with those other resources. We are also doing outreach, and this means referrals to programs. So if you need to be connected to Elder Services for caregiving, they are also still taking people who need care resources. They are taking people for Meals on Wheels if you qualify. So please keep those resources, and you can call our office for information on how to contact them. Telephone reassurance. If you would like a daily or a weekly or every other day phone call, please call our office, and we are setting up scheduled times for people so that we can check in on you if you'd like. Just note that the fuel assistance, Rita Wallstead, our outreach coordinator, is working full-time every day. The deadline for fuel assistance for this year ends on April 30th. So the Plymouth office is also working remotely. If you are either applying for the first time, please call us and let us know, and we'll help you with that paperwork. If you are recertifying, definitely get that application in as soon as you can. If you have any trouble with documents, please check in with us and we can help you. And just to emphasize, our phone number in the office, 508-888-4737. That's the only active line, so go ahead and call that. And I'm going to turn it over to Jackie Lane, Executive Director of NAMI, who's going to give us a few tips, senior and older adult related, on managing stress and emotional health during these times.
I think that one of the things that's going to come out of all of this is there's going to be an uptick in emotional needs, because we all live in stressful times as it is, but we're dealing with something that is vastly unknown, and so much about it is unknown. I think that's one of the things that makes it so scary, that it's an unknown thing. People, I would think seniors, and I think seniors sometimes feel stressed. I'm a senior, I'll admit it, feel stressed because they've lived long enough to see bad things happen. They don't have that same spirit that sometimes young people have, that, oh, I'm invincible and nothing's going to happen. I think that we're going to see seniors, especially those in isolation. I think that you might have more anxiety, perhaps even panic attacks, stress, depression, and those are the things that might be exacerbated by being alone and also by being cut off from your normal way of life. I mean, you're used to going to senior centers, you're used to being with other people, you're used to being able to communicate. So those are the types of things that if you find those happening to yourself, you need to be able to reach out for help. I think that in this area of self-isolation, that it's important to reach back into the things that we used to do when we were young, when we didn't have everybody around all the time. I grew up in a rural environment, and I learned to amuse myself. What about jigsaw puzzles? What about reading? What about, people were coloring a couple years ago, drawing, doing things like that, crossword puzzles. Try to pick up things like that that can make you feel good and can occupy your mind so you're not dwelling on things. Obviously, you want to stay connected, and a lot of you, probably most of you, have internet connections. I would say that's a blessing, and also it can be very bad. I would say don't live on the internet and read feed after feed after feed of the same stuff over and over so that it just occupies your whole mind. Also, there is a wealth of information and misinformation on the internet. So look at what your news feed is. Is it an article from the New York Times? Or is it something you've never heard of? Is it extremely a conservative outlet? Is it an extremely liberal outlet? Try to balance what you're looking at, and don't just sit there in front of the TV or on the internet looking at the same stuff over and over. Clear your mind if it's possible, and we have a lot of open space around here. If you can go out for a walk, we're very lucky compared to the people in New York City that are using elevators and living in big buildings where they have to share space. Go out for a little walk. Try to, even if it's around your backyard if you can, but take a deep breath.
Because Susan mentioned also the call-in as far as that she has too, and that reaches to the point of connecting with family and others just to feel connected at this point.
Now we also, that's one of the things, we have support groups that we're setting up by Zoom, and we are in the office, we're socially distancing, and we're a very small staff. But our office phone, which I'm going to give you, you're free to call us. If you don't get an answer, we certainly will get back to you within 12 to 24 hours to update you on any services you might need, and to also, if you're interested in joining a support group, we can interview you for that and connect you to the right people. Also, we have an updated list of all the resources on the Cape and Islands, actually, and we're trying to keep it current with what they're doing, like we have all the information that Susan just gave you about Sandwich. And the other thing I'd like to say, if you are in a situation where you have a grown adult, child, and some of you are, that has real mental health issues that have been, we're there for support for that too and for resources. We will try to connect you with the best resources. We also have information that we can mail you if you would like some of our things. So please feel free to call 508-778-4277, and one of us will get back to you to help you. You're very lucky in Sandwich. We've worked with this group in Sandwich that has done an awful lot for seniors. The Sandwich EMTs and the police department are very, very up to date on techniques with dealing with people that are suffering from mental health issues. So just hang in there together and try to keep things in some perspective.
Okay, thank you. And as far as, we have a lot of seniors living in senior housing complexes like Shawnee Heights and other forms of that. As far as when they're living in they have a group around them, but they still have to social distance from from everyone. So it's, that's important also, but it's how do you, in that situation too, how do you, what's some suggestions in dealing with your isolation at that point, even though there's people right next door?
I'm wondering, I've thought about this, if it's possible to have like a book discussion group or something that you could set up virtually, that type of thing.
Let me chime in quickly on that. We actually are doing that with that's one of the things I didn't mention, our Council on Aging book club that meets regularly. They are setting up a meeting on Zoom, and that's going to happen in a day or two, and we would be happy to facilitate more of those activities happening.
I mean, I wonder if certain things, you'd have to decide how adaptable they are to Zoom and to distance, but Scrabble, Bridge, Mahjong, I mean, any of those games, I know that chess has taken place,
Virtually.
Yeah.
Yes.
Those kinds of things, just to keep people, and to keep their minds occupied, their brain cells working on something other than worrying about this.
Yeah, because I know we've all received the calls as far as, concern. What are the numbers? What's going on?
I know.
So when you have those concerns, we've provided some resources today for you if you're at home, that you're not alone, and there's people you can reach out to in order to get some information. So by all means, take advantage of those resources and those phone numbers also. So
Now, we will even if you don't need a resource and you just want to talk to somebody, we are pretty good at sharing because our experiences.
fabulous. No, very good. So I thank you very much for joining us on this public service announcement. Anything else, Chief Burke?
No, I just want to emphasize what Jackie said about when you have an incident of this significance, the recovery is usually 3 times as long as the actual incident itself. So there is going to be a long-term effect here. And I just want to reiterate again the phone numbers for Jackie and the folks at Cape and Islands. NAMI, it's 508-778-4277. And for Susan at Council on Aging, area code 508-888-4737. Please take advantage of both of these services. They're absolutely vital to the community.
So when we're going through this and you're sitting at home, don't feel you're alone. There's people here. So just give a call if you have to. So until the next public service announcement next week, stay safe.